Hi, I'm Dr. Abe. I'm an MD and cannabis health coach, and I'm here today to answer your questions about CBD and how it affects your body. Cannabidiol, or CBD, is the most widely known non-intoxicating cannabinoid in the world. It's naturally abundant in cannabis and hemp plants, now available in every type of consumer product you can think of, from oils to edibles and beverages, topicals and skincare, and vapes and flour. Today, CBD is the only cannabinoid with enough rigorous studies to also be purified into an FDA-approved medication for a few seizure conditions. What's more is that there's even wider range of potential benefits to gain without causing a high and disrupting your day, or causing the other potentially uncomfortable side effects of THC. Because of its effectiveness and practical advantages, it's no wonder why CBD is the rock star of the medical cannabis world. The best supported and most definitive benefit of CBD is as an anti-seizure medication for certain rare childhood syndromes, in the form of Epidiolex. Aside from its prescription use, pretty much all of my patients use over-the-counter forms of CBD to improve their sleep, mood, manage daily anxiety at work, school, or in social and public settings, and relieve chronic pain in conditions like arthritis, neuropathy, and cancer. I've witnessed and experienced firsthand just how life-changing CBD can be when other therapies aren't enough. For me, CBD has helped me in overcoming my long COVID and the many challenges that came with it, like my PTSD, inflammation, brain fog, fatigue, and poor sleep. I like to explain to people that CBD isn't impairing, and that adding CBD doesn't create any new or weird feelings. Rather, it alleviates or takes away some of the symptoms or bad feelings that were already there. Basically, if you already have symptoms under control, then taking CBD shouldn't cause noticeable side effects, while still giving you subtle anti-inflammatory and other pro-health, anti-cancer, or maintenance effects by enhancing your endocannabinoid system. But if you're experiencing anxiety, depression, nausea, pain, or sleep problems, then CBD may be useful in calming those symptoms down. The main clinical advantage of pure or isolated CBD is that it won't get you high. Unless you take a large amount of THC with it, full-spectrum CBD is also non-impairing in typical or recommended doses. This means that you can effectively use CBD all day for alleviating your symptoms or condition in a way that won't stop you from doing work or getting the necessary parts of your day done. In fact, CBD can also directly counteract the high caused by taking too much THC. Yes, CBD has a very wide range of safety and dosing tolerability. CBD is studied to be well tolerated in people in doses of up to 1,500 milligrams per day. But you certainly don't have to take nearly that much to get the benefits of CBD. Most people find that starting around 10 to 20 milligrams of daily CBD is a good starting point for getting the most benefits. Everything has potential side effects, including CBD. These are generally uncommon, mild, and depend on the dose you take. The one I most commonly hear about is sleepiness, which can be advantageous if you take CBD at night. You may also have less appetite while taking CBD. If you take a really large dose, then you could experience things like upset stomach, nausea, vomiting, or diarrhea. But these are not really common. Side effects should resolve on their own within a few hours of the dose. Many large studies show CBD is a relatively safe substance, but may increase the levels of important medications. These are things like blood thinners, antidepressants, anti-anxiety drugs, steroids, beta blockers, antipsychotics, and other anti-seizure drugs. It may also increase the levels of other common medications, but most often it doesn't cause a clinically significant reaction outside of seizure medications. However, if you are taking these prescriptions or have specific health concerns, you should ask your doctor first before taking CBD. Absolutely, CBD is the most common, well-tolerated, and useful cannabinoid in my tool belt. With my patients, I typically first try a 1-to-1 combination of full-spectrum CBD and CBDA to maximize their levels and effectiveness, before reaching for other cannabinoids. In my experience, I have the most patient success using equal parts of CBD and its acidic form, CBDA, along with a synergistic terpene profile that I customize for them. The best part of CBD is that because it doesn't get you high, you can recommend it to almost anyone, even children or elderly patients, with your doctor's blessing. Also assuming that they are not pregnant or breastfeeding. You should also still have regular doctor's visits and specialist visits and not self-treat. I always start with CBD as the cornerstone for building a non-impairing and daily routine for my patients with many conditions like anxiety, depression, insomnia, and chronic pain. For people with advanced pain needs like cancer or muscle spasms, smaller or equal doses of THC may be added to CBD to deliver a stronger effect that those patients need. If you've used CBD, let us know about your experience in the comments. Or if you have more questions about CBD, also write them in the comments section and I'll try to answer them or point you in the right direction. For more information on CBD, visit the link in the description.